nerve tension test, which is number 3. A lot of physios get negative results because their handling is not great. Does anybody get pain down the medial side of their arm at all? There's 200 of you. I hope somebody does. Oh, good. Thank you. So again, when would I be using this? I would be using this if somebody has pain down the medial side of their forearm, if they have compression of Guyon's canal, so entrapment of the ulnar nerve in the Guyon's canal, or in the cubital fossa, or if they had perhaps thoracic outlet syndrome, thoracic outlet syndrome, where there is compression of the inferior portions of the brachial plexus. Thank you. And then it's only because then everybody else can hear. Okay, and they are videoing, so it's to give the value after I've left. So if they get particularly if you've got thoracic outlet syndrome, which is quite common, pain down the inferior portions of the brachial plexus, this can be a really invaluable way of sensitizing, more valuable than just doing your standard neurodynamics. Where do you get your name is Shivani? And where do you get pain, Shivani? Okay, so are you not higher up as well? As well? Okay, I'm just going to see if she's got perhaps thoracic outlet syndrome. Can you take off your glasses and line your stomach? And glasses? So I'm going to check her stomach. Right. So I'm going to check her first rib. So come up so your forehead's resting. Thank you. So set yourself relax. You're going to feel the first rib, its ability to depress. Now obviously if somebody's got thoracic outlet syndrome, I'd be looking at why. One of the major reasons thoracic outlet syndrome is an overactive scalenus anterior, which is often related to the way somebody is breathing. If they're apical breathers, rather than breathing in the basal, because of anxiety or because of a history of back problems, it predisposes you to this problem. Is there any pain there? Yeah. And when I compare sides, same. So she's got a very positive first rib. Her first rib doesn't descend as well. I suspect the scalenes are very shortened. So I haven't got time to do a full assessment, but I would never just do upper limb tension test 3. I would be looking at why is there altered neurodynamics in the first place. But just to show you the technique, can you lie on your back for me? So whoever is friends, make sure you mobilise her first rib. It will make a big difference to her neck and her arm, I suspect. So really important, if you've learnt that in the shoulder, the quadrant position, I'm not sure if you learned that, but you actually get your hand up under the scapula and depress the scapula, okay? So I'm depressing the scapula, which sensitizes the system already. I bring her elbow down, below the coronal plane. Any symptoms yet? No? And then I'm going to pronate her elbow. You feel it already? No, good. And then I'm going to get extension of the wrist. And again, you don't have to worry about this side now, because it's the medial side you have to stretch, okay? And then walk around with her until if you get normal responses, you get no response to 90 degrees. Now she's getting it at 90, so that's a positive response. To prove it, you get her to laterally flex away. So laterally flex to your right. No, not turn your head. No, that's rotation. Lateral flexion. No, that's rotation. Can somebody help? There we are. Yeah, that's it. No, that's it. That's it. Does that change it? Does that change your sensation? Thank you. That increases it? Does that increase it or not? Okay. So we've got a positive tension test. Lateral flexion away increased her forearm pain. So I would be doing neural glides of the ulnar nerve, as well as treating the cause, which is the first rib usually. But then I look at why. That's again, if I ever get a chance to do a course here, it's not just about doing techniques, it's why. Why are the scalenes overactive? I'd look at her breathing pattern, and already I can see she's certainly not bibasally breathing. Do you have back problems? Yeah, so she's got low back problems before or after this problem? Sorry? They came on the same time. Because a lot of thoracic outlet syndromes is a result of poor lumbar control. And what happens is you started using diaphragm to actually be your primary respiratory muscle. It descends to increase stability in the lumbar spine, and then you're sacrificing diaphragm as a respiratory muscle. You have to breathe somewhere, so you breathe in the upper half of the lungs. Scalenes are not designed, thank you very much anyway, by the way. Scalenes aren't designed to be on all the time. Its fibres are designed to be on all the time. Scalenes are only meant to be used when we've got high need for breathing, like running and sprinting, when we need maximum inspiration. So their fibres are primarily phasic. They fatigue. When they fatigue, they become shortened. When they shorten, they compress C2-3 and cause headaches, or they lift the first rib and lead to compression of the inferior portions of the brachial plexus, which then leads to thoracic outlet syndrome. So if you just continue just to treat the symptoms, the positive neural glide, the upper limb tension test with the ulnar nerve, or you just treat scalenes, you'll get somebody so far that they'll never get 100% unless you address why, and that's when you need to look beyond just that area. And that's why I asked what's her low back, and she said she's had low back pain for as long, and I suspect her spinal control is affected. And so where would I head? Not only would I treat upper limb tension test and treat the first rib and lengthen scalenes, but I would also look at her motor control and her lumbar spine, and I may need to give her exercise for that, so I can get her diaphragm to start working more as a respiratory muscle, less as a stabilising muscle. That is where great physios head. They actually look beyond just the tissues that they're involved with. Now, I think I am out of time now, so I'm going to, in the last few minutes, ask questions. Is there